Thank you. I was going to say that might be a bit too premature because we haven't got funding or so. So it's way too early stages for that. So I was asked to sort of present on this sort of study we're thinking about, but because it's quite early stages, I'm going to actually spend my presentation mostly talking about other people's work and sort of talking about this background area. So yeah, I'm Kelly Lloyd from University of Leeds. And so yeah, I mentioned I was mostly going to talk about the sort of background literature to sort of weight and cancer risk in Lynch syndrome and the sort of exercise and cancer risk in Lynch syndrome, and then briefly touch on our study at the end. But yeah, there's no trial to join yet, unfortunately. Yeah, so the background to this. So sort of background to weight and cancer risk. There's been a number of studies in this with the general population that have taken like a massive cohort of people and looked at this over time to look at weight and cancer risk in the future. And I'm just going to summarize this from CRUK rather than go on all to that kind of research. And CRUK have kind of summarized it as people with a BMI under 25 have a reduced risk of developing 13 different types of cancers, such as breast, womb, bowel, ovarian, stomach, and pancreatic. Um, as we know, it doesn't mean that a person will definitely develop cancer being at higher weight. It just means that their risk increases. And why is this? So I'm not a biologist, and I really can't say, but I thought the summary from CRUK was pretty nice. They just sort of talk about that some of the key research in this area talks about the signals released by fat cells can affect growth hormones, inflammation, and sex hormones. And there's other research being done as well to look into this further. Now, in Lynch syndrome, there has been a small number of studies looking at this in Lynch syndrome, looking at the relationship with weight and cancer risk. Couple of studies that have done looked into this found that there was a relationship between weight and bowel cancer risk, but mostly in men. But there has been a study that's also found this among men and women. And I thought this is a study I was just going to highlight because it's also the CAP2 study basically was reanalyzed. And obviously we know the CAP2 study, which looked at aspirin and Lynch syndrome. The data set with over 900 people with Lynch syndrome was reanalyzed to look at the relationship between weight and cancer risk. And the study results found that across both men and women, the whole group, people who had a BMI of 30 or over had a higher risk of developing bowel cancer. And they also, people with a BMI of 30 or over, also had a higher risk of developing a Lynch syndrome related cancer. So when all the Lynch syndrome cancers together in one group with bowel and other cancers, they had a general higher risk of developing one of these cancers. And when we have some nice proportion data that was Tim Bishop reanalyzed for us from the study to sort of look at cancer risk among people with Lynch syndrome in sort of proportions. And basically, 32% of those with a BMI of 30 or over developed a Lynch syndrome-related cancer in 10 years. And in comparison, 19% of those with a BMI of under 25 developed a Lynch syndrome-related cancer in 10 years. Interestingly, I was just going to note that aspirin does seem to reduce this risk. So the study looked at, it's the CAP2 study, so half the sample's taking 600 milligrams of daily aspirin and the other half is taking placebo, so the control group. And it basically compared both groups, and it found that those with a BMI of 30 or over taking 600 milligrams of daily aspirin, they did have a lower risk of developing cancer compared with those with a similar BMI in the placebo control group. There was sort of still a trend of having a higher risk, but sort of in statistical terms, it was no longer statistically significant. So this, I'm just going to go now into sort of background with exercise and cancer risks. You might have heard before that regular exercise can reduce the risk of developing some cancers. And why this is, so this is a summary from CRUK. So exercise likely lowers cancer risk by helping to keep a healthy weight, and therefore it lowers the risk of developing those 13 different cancers I mentioned earlier. But also they speculate that exercise may also reduce cancers such as breast and bowel separately from weight through a different pathway. And I know there's research into this, but it isn't clear yet how much. There's also research about cancer survival. It's really interesting with exercise. So one massive study, which was a review of multiple studies following over nearly 50,000 people. So this is just general population, but found that people who had bowel or breast cancer before, who increased their exercise by any amount from pre to post diagnosis, had a 39% decreased risk of death from any cause. So how does this relate to Lynch syndrome? So it's a much less researched area, but has been in a small number of studies that have looked at exercise and cancer risk among people with Lynch syndrome. So I won't go through all of them, but I'll highlight two. One study looked at exercise and cancer risk in over 2,000 people with Lynch syndrome. And this study found that those engaging in the highest levels of exercise had a 29% reduced risk of developing bowel cancer compared to those engaged in little to no exercise. However, I really wanted to highlight that when I looked at that study further, the exercise levels were really high. They were like multiple hours a week of vigorous exercise, and I just don't think it's very realistic for most people. But there's another study as well that was interesting, where they gave people with Lynch syndrome a 12-month exercise program. So it's a completely different study. They gave people with Lynch syndrome a 12-month exercise program using exercise bikes, 3 classes a week, 45 minutes each class. And they looked at the immune response in people's colons, and they found evidence suggesting improved immune response, suggesting exercise would reduce the risk of bowel cancer. So I wanted to kind of talk about what the limitations are of the research in this area and why it's quite hard to do. And it kind of links onto the study that I mentioned earlier, where you might be thinking, why do they look at their colon and not cancer events? And it's just that that's quite a hard area to investigate. It's really difficult to study if intentionally reducing weight or increasing exercise levels actually reduce the number of people developing cancer. It's a really hard area to investigate. And why? Especially in the general population, this is because cancer events are so low. You would need a massive number of people that you'd follow over a long, long period of time, and it's just not feasible, as far as I'm aware. That's the big kind of barrier. So it's also why that kind of study before was looking at immune response in the colon, because you still need a lot of people with Lynch syndrome for those studies. But it is more possible to investigate this among groups at high risk of cancer. And there has been 2 ongoing international studies looking at the effects of intentional weight loss or increasing exercise among people who've had breast or bowel cancer. So not Lynch syndrome, they've just had breast or bowel cancer, but this has kind of been going on at the moment. And it's quite novel. So the behavioural trial for breast cancer and challenge trial as well for people with colorectal cancer. So this leads on to like a kind of big vision of this study that we're thinking, but probably too ambitious. But before a weight management exercise program could be offered in the NHS for people with Lynch syndrome, we need to know really if it prevents Lynch syndrome cancers. To address this gap, we would test a commercially delivered NHS partner program known to support weight management and exercise for people with Lynch syndrome. And this leads on to kind of this project, which I haven't got funding for and I can't really speak much about. So I'm just going to briefly highlight it. So it's a lifestyle intervention for people with Lynch syndrome, Life with Lynch. And it would be a weight management exercise program for people with Lynch syndrome. We've got a company that can deliver this, which is an NHS partner company. And it recruit people with Lynch syndrome who have a BMI of 30 or over, and predominantly recruiting people through genetics, we think. But I can't say much because, like I said, I don't have funding. So there's not a lot to say. But how kind of we envision this is probably starting with a sort of pilot feasibility trial in a smaller number of people to sort of understand this better. And I guess a long-term vision, if it was ever feasible, is a full trial. But you'd need over 1,000 people with Lynch syndrome with a BMI of 30 and over, which may be really ambitious. But that is the kind of numbers you need to look at look at cancer events in like 10 years' time. So yeah, we know that for sure because we've done sample size calculations and it is big numbers. And I just wanted to finish off with saying we had patient involvement as well. So we recruited 5 people with Lynch syndrome and higher weight to a user advisory group. Thank you to Lynch Syndrome UK who advertised this opportunity, and we had an amazing response. We've met with the group multiple times to discuss the study. And I know some are here today, and just thank you so much for taking part in this. And the group just in general stressed the need for programs such as this for people with Lynch syndrome, which are currently lacking in the NHS. And to conclude, it's watch this space, because there's not much else to say, but I hope you enjoyed me talking about other people's research. And thank you to everyone who helped here.